Good afternoon, everyone. My name is Arturo Garcia Costas. I'm the Senior Program Officer for the local, national, and international environment with the New York Community Trust, one of the oldest and largest community foundations in the country. I'm also co-chair of the Lead Funders Action Network and a longtime anti-lead warrior, having worked on accelerating the phase-out of leaded gasoline in the Americas for a few years fresh out of law school. Thank you so much for joining us for this timely briefing on preventing childhood exposures to lead. Because of the dedicated and often passionate work of parents and community leaders, federal and local officials, and the public health community, hundreds of thousands of children over the past few decades have been saved from suffering the lifelong effects of lead exposures. However, the challenge remains enormous, and there are many shortcomings in our approach to making homes and communities lead safe. Thankfully, there are also interesting and innovative solutions making communities and homes lead safe. National Lead Poisoning Prevention Week is October 22nd to 28th, and we invite you to share what you learned today with your colleagues and others as we get closer to that week to heighten awareness of childhood lead poisoning and the need to prevent this scourge. We will be recording today's congressional briefing, and we will send a link of this recording to all who registered. So, logistical detail, if you have questions during today's briefing, go ahead and put them in chat and mention the organization that you're with and who the question should be directed to. We have a pretty amazing panel of experts who have been working in the trenches on this issue for a long time. Our speakers include a congressional champion in this space, Congressman Mike Quigley from Illinois. We will then hear from a very passionate parent advocate, Allison McShane, with the Detroit Lead Advocacy Parent Group. Next, we will hear from Dr. Maury Markowitz, who serves as director of the Lead Poisoning Prevention and Treatment Program and professor of pediatrics at the Children's Hospital at Montefiore in New York. We are very pleased also to have with us the HUD Office of Lead Hazard Control and Healthy Homes Director, Matt Amon. And we will hear from Rebecca Morley, who joins us from across the pond in London today. Rebecca is a seasoned expert in health and housing policy. Rounding out the panel, last and definitely not least, is Oceana Fair, Southside branch leader at Families for Lead Freedom Now in Syracuse, New York. We will close out the hour with a question and answer session. Without further ado, let's hand it over to Allison McShane, who a Detroit lead parent advocate, activist with DLEAD, and a parent of a child affected by lead poisoning. Go ahead, Allison.
Hi, good morning, good afternoon. Thanks for having me, and thank you all for being here and listening, and for everything that you are doing for lead poisoning. So I'll start with my personal story. In 2020, we were getting ready to undergo renovations in our Detroit historic home. It was going to be our dream home, but it was something we could never afford in the suburbs, and we knew it was a fixer-upper. We had a difficult time conceiving our son, so we underwent IVF, which made us even further in debt. But we decided to live in our house while we were doing the renovations, and work on everything kind of one project at a time. But my son, when he was around 9 months old, he was happy and healthy, but we were doing more serious renovations, and I became worried that our house wasn't safe to live in, even though we were keeping him away from areas. So I asked our pediatrician to test him for lead, and she kind of gave me a funny look. She said, you know, he's only 9 months old, and we only test for children on Medicaid, and you're not on Medicaid. So I was like, well, I still want you to test him anyway. And she went ahead and did it, and we went around the rest of his exams. But as we were leaving, she pulled me back into her office and said, you know, you were right. His levels are elevated. I think they were at a 10. And she said, you know, you need to go and get a venous draw right away. So we confirmed the venous draw, and it was at 8 micrograms per deciliter. So the CDC uses a blood lead reference level of 3.5 micrograms per deciliter to identify children with higher lead levels compared to most children. But this BLRV is a population-based measurement that now indicates that 2.5 of US children age 1 to 5 had lead levels at or above that 3.5 micrograms. So it's not a health-based standard or a toxicity threshold. So no amount of lead in the blood is considered safe. So I panicked. I immediately moved my son from the home. I moved in with my mom temporarily to care for my son and to, tackle this dragon in our house. But had I not insisted on testing him and removed him from my home right away, this could have been so much worse. The health department called us. They're notified that his levels were elevated, and they referred us to some resources for grants and funding, which we unfortunately didn't qualify for. But they also referred us to DLED, which is a parent group for resources and support, who have helped us immensely and turned me into an activist. We had the entire house tested, and the cost to remove the lead on top of our other renovations was just more than we could afford. We didn't, like I said, we didn't qualify for any of the lead abatement services or grants because our income was just above the eligibility level. So we ended up selling our dream home. We sold it to an investor who could afford the expense of remediation, told him, gave him the report that was done where the whole house was tested. We were deeply devastated to lose our work in progress dream home. But this consequence was nothing compared to the impacts of lead experienced by other children and families in our community. So unfortunately, our story does not end there. We bought another historic home in Detroit that also contained lead hazards that we didn't find out until we closed because our realtor waived the inspection period unbeknownst to us, where we could have paid out of pocket to test the home for lead because we were in this bidding war, and she's just like, hurry up and let's get the house. And so I, of course, had the house tested as soon as we moved in, and there was no lead dust in the home, but there was lead paint present on many of the walls, and they were beginning to deteriorate. So we made plans to move into my husband's art studio trailer in the middle of winter for the duration of the month-long abatement. But before we could leave, the contractors that we hired began several non-lead projects while we were still in the home. And the contractors advertised that they were specialists in lead abatement. However, when they were working on an area in the kitchen, ripping off countertops, they were pulling the countertops off a lead positive wall, and they had the whole lead report. And I was like, isn't this a hazard that you're creating right now? And the contractor just was like, well, he's not chewing on lead paint chips, so he should be fine. And I was just like, I was astounded. So I began to question whether or not he was RRP certified, the renovate, repair, and paint certification. So, because there was no plastic sheeting down, there was no HEPA filters. And he had nothing to say about the sanding and the dust that was in the air. So yes, young children with their propensity for exploring and putting everything in their mouth can sometimes eat lead paint chips because they taste sweet. But as I learned from our last experience, that lead dust caused by crumbling paint or renovations is currently the main source of lead exposure among children in the household. So we moved out of our home for a month so they could wet scrape the lead positive paint areas. But I had another gut feeling about these contractors that they were not properly trained. So I actually had the house tested by another independent testing company before we moved in, kind of behind their back. And, where there was no lead dust in our home, they created it with the practices they used. There was lead dust in all the areas that they said that they cleaned up. So I made them come and clean, retest, and I was like, you're paying for another test because this is $1,000 out of pocket every single time we want to test the home. So yeah, it was a mess, but I'm really glad and thankful for the education I received through DLED and the health department. My son's blood lead levels have gone down, but are still elevated, and this is several years later. And it worries me every day that he's going to have learning or attention problems. But I know he's super smart because the other day I asked him, what do we do when we cross the street? And he answered, we run real fast. So his he's only 3 years old, but his sarcasm and humor is very well developed. So hopefully that counts for something. So the lessons learned through all of this is you don't have to eat peeling paint chips to be exposed to lead. There's many sources of lead exposure in and around the home. It's lead dust is the most common way that people are exposed because before 1978, lead was used in paint on exterior surfaces like doors, trims, windows, porches, due to how durable it is. And as a home ages, the paint begins to deteriorate, break down, cause chipping and peeling. So any surface that is covered with lead paint where paint may wear or be like rubbed off friction, like windows and doors, is likely to cause lead dust. So I have this little vial here. And so had this vial contained 10% of lead, paint, this would be enough to contaminate a 1,500 square foot apartment. I don't know if you can see it. And this was given to me by the Ecology Center in Detroit. So, so it can also be found in jewelry, toys, home remedies, spices, ammunition, tackle, ceramics, candy. We found it in the tile glaze in our bathrooms and bathtub. But I've heard of it being in garden hoses. And so, yeah, it's everywhere. And the other lesson 2, is that many health care professionals, contractors, people who are supposed to be in the know are not, or they're just not as concerned or proactive about it. My obstetrician, when I was pregnant, could have screened me and asked, where do you live? How old is the home that you live in? And if I rented a property, further that information channel. Our pediatrician could have asked those questions, and our contractor should have been educated on the hazards, especially if they were touting that they were experts in it. And the third lesson is that it's not difficult to find out if there's a potential environmental lead hazard in your home, but it's expensive. Each time we tested our house, it was between $600 and $1,000, depending on the size of the home. And then lesson 4 is that correct abatement is important. A lot of landlords in Detroit, they have to pass a certificate of occupancy and have the home tested for lead, but most of the time they just cover it up with a really thick paint, and that doesn't guarantee that the lead is abated. It's still there. So federal law requires contractors that disturb paint surfaces in home, childcare facilities, and schools built before 1978. They have to be RR certified, renovate, repair, and paint, and they have to give you this little pamphlet. But they also have to know the information in there and follow it. So lesson 5 is that you need to be an advocate and an activist. Had I not advocated for myself and for my son's health, he would have never been tested. He probably would have, that his level would have gone higher and higher, and he would have had, more health and cognitive effects than he does. So, and the activist part is joining DLED, the parent-led advocacy group. And we're a group of parents, educators, and community partners who are working to build awareness and create strategies to end lead poisoning for Detroit's children. We share awareness, education, and prevention techniques with families dealing with a child who has elevated blood lead levels. So it was launched in May of 2019 as a Wayne State University Center for Urban Studies program funded via grant from the ERB Foundation. And more than 60 families have engaged with DLED since its inception, mainly arriving through referrals from the Detroit Health Department. So we meet monthly on the fourth Thursday, and we have various speakers. We educate parents on this issue through topics like getting your child tested, lead safe housing, lead in the law, proper nutrition, cleaning, like cleaning the dust out of the home. If you can't move out of the home, there's proper ways of kind of mitigating the lead dust, demolitions, lead safe gardening, water, and then renovations to reduce lead and much more. So our target priorities are to for universal blood lead level testing for all children under age of 6 in Michigan, better enforcement of the Environmental Protection Agency's 2010 lead renovation, repair, and painting room, which was the pamphlet that I showed you, relocation of children who required hospitalization for lead poisoning, better data sharing about homes where lead exposures have occurred among city, state, and state agencies, and better enforcement of the Detroit's 2010 lead ordinance for rental properties. We also have achieved many successes. Just recently, we successfully lobbied for the state universal lead testing bill that Governor Whitmer just signed last week. 3 cheers for that. With the passage of this, all Michigan children will now be tested at ages 1 and 2, and this will be part of a standard routine healthy child doctor's visits and recorded in their immunization record. So that's huge. It will follow them. And so right now, only about a quarter of kids are being tested and getting access to lead elimination resources if they need it. So we hope that this is just the first legislative victory in the state for lead impacted families and environmental health advocates. Water filters in schools and daycares filter first, and lead safe renovation practices, RRP, are hopefully next. We also created and advocated for the successful passage of lead prevention resources for the city of Detroit and Wayne County. We've spoken to federal, state, and county and city lawmakers about our lead priorities. We just had Rep. Helena Scott as a presenter a few weeks ago. We've been featured in Bridge Magazine, Planet Detroit newsletter. We've created outreach materials to educate the community, and we participated in monthly meetings learning from a wide variety of speakers. Okay, I'm moving on a little bit. So I was thrilled to be one of the families from Detroit to participate in Michigan Lead Education Day. I also was the keynote speaker at the 2021 Michigan Lead Education Day. And I'm going to skip over a little bit of the lead poisoning background, the effects of it, and scoot on down for time to the scope of lead problem in Detroit. According to the Michigan Alliance for Lead Safe Homes, about 70% of the houses in Michigan were built before 1978, the year in which lead paint was banned. But because of these high numbers, in 2019, over 1,200 children were diagnosed with lead poisoning in the city of Detroit. So statewide, another 3,996 children were found to have elevated blood lead levels of 5 to 9. But it's difficult to gauge the full extent because only half of the kids who were tested who should be tested are each year. So I was going to talk about the Detroit Land Bank and some insurance stuff, but I'm going to skip over that and talk about the costs of lead poisoning. Conservative estimates show that lead poisoning costs Michigan at least 3.2 to 4.8 billion just for the annual cost of lifetime earnings for children with lead poisoning. So this doesn't include the cost of medical treatment, special education, increased encounters with the juvenile system, or reduced school completion. So in conclusion, to achieve a lead-free future for our children, we need to invest in primary prevention solutions for childhood lead poisoning, beginning with healthy houses, not sick children. The canary in the coal mine should not be children's negative health or behavioral consequences. Every house bought and sold should be tested, and real estate investors and landlords need to take more accountability, have stronger regulations and scrutiny. These prevention efforts save lives, increase jobs, and ultimately save taxpayer dollars. So for every dollar spent controlling lead hazards, at least 17 would be returned, and as much as $221 in health benefits, increased IQ, higher lifetime earnings, tax revenues, lower special education costs, and reduced criminal activity. So thanks so much for having me, and I'm sure Dr. Markowitz is going to talk about the effects and the treatments, and thanks so much for having me.
Thank you so much for sharing that harrowing story, Allison. And it's also inspiring the degree to which you saw the situation and worked to address it in all sorts of ways, and took that energy and became an advocate. So let's turn over the mic to Dr. Maureen Markowitz of the Children's Hospital at Montefiore. Go ahead, Maureen.
Thank you. I haven't popped up on the screen yet, so I hope people can see me.
We can see you.
See you.
Thank you. So thanks for the introduction and the opportunity to present here. As a clinician at Montefiore Medical Center in the Bronx, I've taken care of lead-poisoned kids and pregnant women for over 45 years. As a professor of pediatrics at the affiliated Einstein College of Medicine, my research was focused on improving methods of lead diagnosis and treatment. I'm currently the director of the Lead Poisoning Prevention and Treatment Program based at Montefiore. During my career, I've witnessed the marked reduction in the severity of childhood lead poisoning in the US. Kids don't die from lead these days in the US. They did when I started, though they still do die from it in other parts of the world. This improvement is the result of decades of public health efforts to limit sources of lead exposure, historically from leaded gasoline, as Arturo mentioned, lead in household paint, and the sealing of food cans with lead solder. It was my hope that these collective efforts would result in the elimination of my job. However, the massive amount of lead that we distributed and remains in our environment, especially in our homes, has resulted in a failure to eliminate childhood lead poisoning. So I'm still here, working on lead issues. Exposure to lead does not equal lead poisoning. It's got to find a way into the body. For children, that's almost invariably through the mouth. When children eat something containing lead day after day, they begin to accumulate it at a rate faster than they can excrete it. Some of the lead gets into the bloodstream, which carries it to every cell in every corner of the body. We can open a window to see if lead is in a child by taking a small blood sample and measuring how much is in it. From studies of groups of kids, we know that the higher the blood lead level, the more likely toxicity is occurring. Using the blood lead test as the guide to the risk of harm, no safe level has been established yet. I hope someday that we will know if there is such a limit. Most people are aware that lead is a poison to which the brain is very sensitive. Even within the brain, some parts are more sensitive than others. The critical functions of learning and decision-making and impulse control are in the brain's centers where lead is most active. The detrimental effects are associated with poor school performance, inability to concentrate, to sit still when necessary, and to making poor choices, leading to harmful outcomes for the lead-poisoned person and potentially harmful for those around them. It's not only the brain that's poisoned. Long-term studies show increased risks of developing hypertension, cardiovascular and kidney disease in adults, with an associated increased risk of mortality. Poisoning during pregnancy is an especially serious problem because lead crosses the placenta to accumulate in the growing fetus at the critical time of organ development, including the brain. But it's not only the fetus that's at risk of harm and even demise. The pregnant woman also may develop a life-threatening multi-organ disease called preeclampsia toward the end of the pregnancy. The blood lead level determines who will have the priority for interventions to try to remove lead from a child and to prevent further ingestion. It is the CDC that determines that intervention level based on epidemiological and not toxicological data, as Alison just told us. By that, I mean the following. The CDC regularly conducts national surveys of the health of the US population and has included blood lead measurements since the 1970s. Even though average levels have declined markedly since those first surveys were conducted, as recently as 4 years ago, a study found that more than half of the US children still have measurable amounts of lead in their blood of 1 microgram per deciliter and higher. Efforts to help all of those children, more than 12 million, less than 6 years of age alone, would be very costly. Instead, the CDC selects the kids with the most lead in their blood, those in the top 2.5%, as the ones who should receive priority from clinicians and departments of health. The current CDC threshold, as mentioned, for interventions is 3.5 micrograms per deciliter. An estimated 300,000 to 500,000 young children may have levels at or above that amount. One potential part of the intervention is the use of drugs to remove lead from the body. We're primarily using 2 drugs that were developed in the 1950s and 1980s. They're life-saving in cases of severe lead poisoning, but they're largely ineffective at removing lead safely from the vast majority of American kids with lead poisoning, whose lives are not imminently at risk, yet have the potential for the types of harms mentioned earlier. The lack of drugs that can remove lead effectively and safely is a pharmaceutical industry failing. Drug treatment is part of secondary prevention. The person's already lead poisoned. In the absence of effective drugs, primary prevention has to be our goal. That means taking a closer look at the sources of exposure and their elimination so that poisoning doesn't occur. While there are many sources, because lead is in hundreds of products, Alison just gave us a short list. The one that stands out in the clinical realm, which you would see if you came to my lead clinic at the Children's Hospital of Montefiore, is the paint chips or the dust that came from their deterioration. That was the cause of the kids' lead poisoning in about 70% of the time. When we look deeper at the locations of the lead exposure, that lead-containing paint or dust is most often found in the home where the child lives, or a babysitter's home, or a relative's. And that's where I think the preventative efforts need to be concentrated. That's not to say that eliminating lead paint hazards in daycare centers, nurseries, schools, places of worship, or anywhere else a child spends time should not be done. Of course it should. But homes are the priority because that's where the highest risk group, little kids, like toddlers who still put everything in their mouths and now can climb to reach windowsills that can have concentrated amounts of lead. They spend their most time in those homes. Thank you for the opportunity to present this summary of my experiences and views in regards to childhood lead poisoning and its causes. I have a PS to this that I had not originally decided to talk about, but I'd like to point out that lead has not been banned from paint in the US. It's been capped for how much is allowed, and that cap has changed over the years and over locations from federal, state to local jurisdictions. And even currently, a tiny amount of lead is permitted in household use paint. Thank you again.
Thanks so much, Maureen. And another PPS to that is that more than 50 countries around the world are still allowing a leaded paint without any sort of regulation to be used in their economies. So
Much of that, by the way, coming from our multinational paint companies.
exactly, our paint companies are taking the poison offshore. So now let's hear from Matt Amon, who is the director of HUD's Office of Lead Hazard Control and Healthy Homes. Matt has worked with local communities for nearly 30 years to address housing-related health hazards, to prevent injuries and illnesses in vulnerable residents, particularly focused on preventing lead poisoning in young children. Take it away, Matt.
Thank you very much. So at HUD, our programs of the Office of Lead Hazard Control are really unique in the federal government. Unlike many housing rehab programs, the programs of the Office of Lead Hazard Control are intentionally focused on making homes safer and healthier to ensure that children and other vulnerable residents have the chance to grow up in a safe, secure, and stable home that helps them reach their full potential. And in this manner, we are very much focused on providing safe and healthy homes for at-risk families and children. Our grant programs, our outreach, our enforcement has been a critical part of nationwide efforts to mitigate the impacts of unhealthy housing, to preserve affordable housing, and to improve communities and health outcomes. These are really three pillars of our collective work to make sure that, again, families and children can reach their full potential across the U.S. Next slide. Our grant programs, we have three main focus areas for our grant programs. We have our lead hazard control grants, we have our healthy home grants, and on the next slide, I'll show you in a second, we have our technical studies grants. And in many ways, these programs have really been designed by the input from communities around the country to really help them in terms of what their needs are and what their focus needs to be in terms of, again, mitigating the impacts of unhealthy housing. We have a number of different grant programs, again, based on not only the type of work that we focus on, but also in terms of the eligible applicants to our programs. But again, it's really important to note that these programs have really been designed in large part by us listening to communities in terms of what their needs are. And we've continually adapted our programs to what those needs are so that local governments have exactly what they need in terms of producing and ensuring healthy families and children. Next slide. I mentioned a third focus area, technical studies. Research is a key part of what we do. And we also are continually having new programs address new emerging issues in housing. And we are always trying to adapt to focus areas, but also in terms of really what are the needs of communities in terms of fixing unsafe housing. Next slide. So this is just a snapshot. We have grantees across the country. And really the need for these programs remain a critical resource to communities. Next slide. It's also critical to note that the work that we do helps with capacity. We've written the how-to for lead hazard evaluation and control. These are the HUD guidelines for the evaluation and control of lead-based paint hazards in housing. In many states, they've adopted this wholesale, again, because it is the industry standard in how you do the work, both in terms of the evaluation side and also the lead hazard control side. And we've also developed the guidance manuals for healthy homes in terms of how to develop more holistic programs that not only focus on lead, but also other housing-related health hazards. And these, again, have been really critical for jurisdictions to use as they internally build their capacity and infrastructure around the needs for improving housing conditions. Next slide. Really, for us, this is what our work is all about. I mean, our commitment to helping people and communities, I mean, our collective success is really through innovative and creative partnerships, again, through our successful Lead and Healthy Homes programs, evidence-based scientific research, and our lead safety regulations enforcement. And we've continually tried to expand our efforts to build public-private partnerships to bring in more investments to fix older housing and preserve affordable housing and communities. But it all comes down to this, and we know that all work is local. And again, we have continually adapted our programs to the needs of communities to enable them to address housing-related health and safety hazards in a more holistic way, creating efficiencies in the way these hazards are fixed, resulting in proven cost savings and better outcomes. And it's important to note when I had mentioned about our grant programs, we'd really seen and have seen our grant programs to be a catalyst for many different things. One, building better data sharing models to target resources. Our grant programs have really been a catalyst for what we're seeing locally in terms of developing pre-rental occupancy inspections. Allison had mentioned the lead ordinance for rental properties. Again, our grant program being the foundation to help support universal screening and also support the development of local contractors. So in many ways, our grants have really been essential ingredients to allow communities to expand options to solve these local housing and health issues. Next slide. And at the end of the day, all of our collective work, why does this matter? Well, we know that it helps children and other vulnerable populations reach their full potential by preventing injury and diseases, lowering healthcare costs, and then also getting better outcomes in terms of school. Frees up family expenses that would have been spent on healthcare for other critical needs, such as rent or food. Again, trying to prevent these issues before they occur has really been at the heart of this work. Next slide. I think to summarize, this work, it's being part of the group that we have here. I do think it's very, very important to note that us that you see represented here as panelists, they all represent different sectors working together holistically and looking at different approaches to solving local problems. And in this case, it's about mitigating unsafe and unhealthy housing conditions for improved health outcomes. And I think that means a lot when we have, when I say we, it's the collective we in terms of all the sectors that we have represented here to solve what, again, are very much local problems. And that's a very important takeaway, that we are all working together in alignment to come up with new creative ways to solve these local issues. Thank you.
Thanks so much, Matt. I couldn't agree more about the importance of having a dynamic ecosystem of various actors in the mix, from contractors to informed public health officials to families and parents to help address this issue. So let me now introduce Rebecca Morley, who is a strategic consultant to various nonprofit organizations and foundations, and who has been involved with childhood lead poisoning prevention for more than 30 years. Another anti-lead warrior. Take it away, Rebecca.
Thanks, Arturo. Thanks so much. And thanks to the other panelists for their lifelong commitments to addressing childhood lead exposure, and especially to Allison for sharing her deeply personal and very difficult experience and for turning that into action and advocacy. So I'm Rebecca Morley, and speaking of other sectors in the ecosystem, I've been part of the Lead Funders Action Network since it started in 2017. And LFAN, as we call it, is a loose network of national, regional, and local philanthropies who are passionate about ending childhood lead poisoning. And we care about lead from all sources: in the water kids drink, in the homes where they live, and in the communities where they play. And as you've heard from Matt, the national approach has been very successful at finding and fixing lead hazards in communities across the country. And we've learned from these programs exactly what works, what the solutions are. HUD's programs have built a foundation that is really important in terms of moving forward and advancing solutions to this problem. But we do have a major challenge of scaling these solutions. At our current pace, it will take many decades to reach all the children at risk. And that's where the National Lead Safe and Healthy Housing Financing Fund comes in. So its purpose is to accelerate our progress and make sure that what happened to Allison in multiple homes doesn't happen to other families. So at the national level, the way the fund would work is it would blend HUD grant dollars and private capital from traditional sources like banks, impact investments from philanthropy, and then the fund would provide innovative products to local community development organizations, who would in turn make loans and grants to property owners. So although the pool of capital would be blended at the national level, it will provide products that are tailored to the local needs and delivered by local partners that already understand the unique housing and market conditions. We are especially interested in helping landlords who have a small number of units, sometimes referred to as mom and pop landlords, also homeowners who don't have enough equity in the property or cash on hand to make urgent repairs. We imagine grants being needed for these type of owners. We also envision reaching lots of units through corporate multifamily property owners who provide housing for those with low and moderate incomes. Those owners may be able to take on some debt, and so there would be low interest loans for them. We didn't just make this concept up. It comes from two models, and probably others as well, that give us confidence that the approach can work. The first one's called the Healthy Food Financing Initiative, and it created a national revolving loan pool of capital to finance eligible projects in disadvantaged communities. To date, that initiative has helped leverage an estimated $1 billion in additional financing and supported 1,000 grocery stores and other healthy food projects in more than 35 states across the country. So again, this idea of blending public and private capital to address a need. The second is the Cleveland Lead Safe Homes Fund, which has raised $115 million, nearly half of which is private capital. So you're probably wondering, how is this fund any different from the things that Matt already described? As I mentioned, it builds on much of the work that HUD has done, the contractor base, the knowledge of what works. And so some of the differences are that this fund would be designed to be flexible. It can be used for lead paint, dust, contaminated soil, leaded drinking water. It would also be used to address other health and safety risks. The idea is not to go in one day and fix lead, and then another day add a CO alarm, and then maybe if you get back to it, add mold and radon. Each of those transactions has a cost, it's disruptive, and at worst, you could deal with one hazard and leave a life-threatening risk for another day. Second, for the first time, there will be a national mechanism for the private sector to invest in lead safe and healthy homes. And finally, the new mechanism provides an opportunity to streamline regulatory requirements and other barriers to people entering the program. For example, we heard from Allison about her income being just slightly above the amount that would be make her eligible for the program. So we want to look at some of those barriers to entry to make sure that every child has access to the resources that they need. In the first year, we envision a pilot of this program in 3 cities. Places that have strong lead policies in place will be good locations to pilot the fund because their requirements would incentivize participation in the program. For example, Cleveland law requires all older rental units to be inspected before a renter moves in, this proactive rental inspection policy. This can drive demand for the grant and loan dollars as landlords will need resources to comply. So we, in summary, believe this public-private solution holds great promise for bringing lead safe and healthy housing to scale so that we can make sure all children have their best opportunity for health and well-being. Thank you for your time today, and we look forward to your questions.
Thanks so much, Becca, for all that you do in this field. So our final speaker is Oceana Fair. She serves as the Southside branch leader at Families for Lead Freedom Now in Syracuse, New York. Oceana?
Good afternoon. My name is Oceana Fair, and I am part of an organization called Families for Lead Freedom Now in Syracuse, New York. We are a group of families that have been directly affected by the lead poisoning crisis here in Syracuse. This subject is so important to me because of how greatly it has impacted my family. My family has a 43-year history with childhood lead poisoning. I have a 43-year-old brother who I am currently responsible for now that he has outlived both of my parents, who basically has the mind of an 8-year-old. He suffered lead poisoning when he was just 2 years old. So my parents went from one day of having a normal toddler to a few days later of having a child who was seizing on a daily basis. This delayed a lot of things for him, things he used to be able to do, walk, talk, crawl, he all had to relearn. And As he grew older, he became more and more dependent on us. Fast forward almost 40 years later, and my granddaughter gets poisoned in a home that I was renting at the time. We had thought that lead poisoning was this thing of the past, because here in Syracuse and in Onondaga County, we had declared war on lead 50 years ago. So the fact that this was happening to my family all over again became a huge nightmare. We started to fear what was going to happen to our granddaughter, what would come of her life, how would she grow up? And this set me on a quest to figure out what we could do for her and what we could do for our home so that none of our other grandchildren suffered this fate. In doing so, I learned a lot of facts about my community. In the neighborhood that I live in zip code 13205, if you are a Black male child, you have a 1 in 4 chance of being poisoned from lead paint and lead dust in your home. And in that same neighborhood, our children are poisoned at a rate of 10 to 1 to their suburban counterparts. So this led me on a mission to find results and to fix this problem that is completely preventable. There is no reason for any child in the US to ever be lead poisoned. We know it's preventable. So how do we do that? For us, it started out with figuring out how to get our home fixed. So simultaneously, as my granddaughter had become lead poisoned in our home, our local land bank seized our home from the landlord. So now the land bank became our landlord for a while, and as the tenants, we had the first option to buy the home. For us, this was a no-brainer because we figured getting the home fixed, getting the lead remediated, we would never be the victim of a landlord again. But this brought on new challenges for us. The HUD program in our city, if we had had the land bank apply for the application and get the house fixed under that grant, we would fully have to repay the grant upon purchase, even though we were otherwise qualified for the grant. So going through all the paperwork with the land bank and us getting in a position to buy, it took 12 months before we could close on the home. We then had to apply for the grant ourselves that we were already qualified for. That put us on an additional 18-month waiting list to get our home fixed. So now 2.5 years later of us trying to make sure we're keeping our grandkids protected and worrying about this silent predator that was existing inside of our home, we were finally able to get the home remediated. Families for Lead Freedom Now was instrumental in helping to pass a local lead ordinance similar to the one in Rochester and Cleveland that you've heard about. While this was a big step forward for us, it also came with its own challenges because now we had a law requiring landlords to fix the hazards locally, but there's no funding behind helping them to fix the hazards. In order for us to get ahead of this issue, we need to bring landlords in as partners because that's the only way we're going to solve the issue. They need to be partners in this issue. Syracuse is a longstanding HUD lead grant recipient, and they do use the Green and Healthy Homes Initiative's grading funding model to fix the hazards, which is instrumental in us in getting our home fixed. It made sure that all the hazards were covered. Things that went above the grant, lead grant, that would not have been covered were covered due to that Green and Healthy Home funding. How can Congress help? A national lead safe and healthy home fund would help communities like Syracuse access more flexible, customizable forms of funding than it currently has. Pairing more flexible federal funding with Syracuse's lead ordinance would help us finally end childhood lead exposure, while supporting job creation, housing stabilization, and home ownership. The housing stock in Syracuse, over 80% of the housing stock was built prior to 1978. We are an industrial city. Syracuse was known from everything from steel mills to pottery in its heyday, to even auto manufacturing. But all of that manufacturing brought some deep hazards into our community. The local government and nonprofit lenders need technical assistance and financial support to repeat models like the Lead Safe Home Fund in Cleveland, Ohio. or the Buffalo and Erie County Landlord Property Improvement Fund. In conclusion, what I'm saying is lead exposure shouldn't happen to any family. We know that it's completely preventable, and as was mentioned earlier in the program, our children shouldn't be the canary in the coal mine finding the lead. We should be finding these houses prior to finding children with lead. Dr. Markowitz has pointed out all of the various issues that our children can suffer from. And as I have explained with my family, where it's become multi-generational, my brother is now completely dependent on me and my siblings for his care. And if he outlives us, we worry very much about what will happen to him. Local government can't do it alone. Our communities need flexible federal financial support that can meet the moment in 2023. A national lead-safe home fund could help ensure flexible funding remains available until every child in America has a lead-safe home. No child should have their future stolen away as a toddler from microscopic lead dust that their parents didn't even know existed in their home. This is a fixable problem. If we have the will to do it, let's not pass this on to the next generation. My goal is to make sure that my children's children do not have to worry about suffering from lead poisoning. Thank you again for your time, and we look forward to your questions.
Thank you so much, Oceana. And that story just was so powerful. So we actually had corrected the technical snafu we had earlier with the video. So we're going to go ahead and use that as the entree into any questions and answers we might have. Go ahead, please.
Congressman Mike Quigley here, and I want to thank the Lead Funders Action Network for hosting this timely briefing on the threat that lead paint and other lead sources in housing present to children, the elderly, and other vulnerable populations across our country. Lead paint and the dust that lead paint creates when it cracks or peels is among the most hazardous sources of lead exposure. This exposure is the leading cause of lead poisoning in Chicago. Despite a ban on lead-based paint for residential use in 1978, an estimated 29 million homes in our country continue to have significant lead-based paint hazards. Closer to home in Illinois, lead paint hazards are present in 99% of Chicago homes built before 78. We know that lead exposure is linked to irreversible neurological damage and developmental delays in children and can seriously harm people of any age. Despite that danger, the majority of children are not regularly tested, and therefore their lead poisoning goes undetected. Luckily, solutions to lead poisoning exist. By repairing older homes, we can substantially cut the number of children who are irreparably harmed by exposure and provide a pathway to greater opportunities for health and racial equity. As a ranking member of the Transportation, Housing, and Urban Development Appropriations Subcommittee, I'm proud to work to support programs like the Lead Hazard Reduction Grant Program and the Healthy Homes Program and the THUD bill. These programs protect the most vulnerable Americans from the threat of lead poisoning and increase the pace at which we eliminate it from our communities. Despite the progress that has been made in the previous decades, the threat remains and the job's not done. I'll continue to work in Congress to ensure the threat of lead poisoning decreases. I'm thankful to work with LFAM and other groups on this important effort. Have a great day and keep up the good work.
Excellent. We realize we're at the top of the hour, but we're going to go over a couple of minutes. We understand that many folks may have to leave because it's the top of the hour, but we'll stay on a couple minutes to do a couple of the questions that came in. What's the first one?
Hey, Arturo. The first question is, do we have some updated data on lead poisoning in our country? You know, many are referencing data from the 2010 census. So wanted to ask our panelists if they're seeing enough data collected to really give the full picture of this problem in our country.
Thank you, Katie. Was that open to all the panelists?
open to anyone who might like to jump in.
Maury?
I'll take a step in. So I think just the way the question is phrased results in a tricky ability to answer it, or it's not so simple to answer because it's asking for lead poisoning. And lead poisoning isn't the same as the 3.5 or 5 from a few years ago intervention level that the CDC sets. So I don't know of the distribution of blood lead levels since even before the 2010 that tells me all of the blood lead levels across the population. The CDC does have that data because that's part of their NHANES surveys that they do that I alluded to in my talk. I just don't have that full distribution in my head. We'd have to go to the CDC website to look from there. There we go. Here's our connection. Thank you. Thanks, Rebecca.
And I will put that link with that data in the question box for everyone.
And I will add to that response that in some states, New York, for example, New York requires every child when they reach 2 years old to have their blood lead levels tested. But accessing that data in New York State has proven to be really, really challenging. So there is issues of the data that exists and the accessibility to that data and how that data could be used to inform decision-making at the local level. It's a big challenge, ongoing challenge in this field.
Actually,
Oceana, do you want to weigh in there?
I was going to say, we also have to look at the fact that a lot of our parents, even though they should be tested at 1 and 2, we know here in Syracuse that only approximately 50% of those children are being tested, and that has to do with parents having access to testing. So there are also barriers for children who are living in poverty having access to testing, whether that's having health insurance, whether that's having a primary care physician. There's several things that our organization has found that prevent parents from getting their children tested.
And just to add to that, COVID has really further exacerbated this with kids missing pediatrician appointments. Even if they did have a pediatrician appointment where this is recommended, they might not be going back for that blood draw. And because of the stay-at-home orders, kids were often in lead-poisoned homes for longer. So it's, you know, as Oceana says, it's not the full picture, and COVID didn't.
Maureen, did you want to add something else?
Yeah, just to follow up on what Oceana just said. So New York State is one of the states that follows the CDC guidelines for testing because it's a high-risk state with so much old housing. So kids are supposed to be tested at a minimum of 1 and 2 years of age with a blood test. And the number 50% is actually a statewide number exclusive of New York City for kids who actually get 2 tests during those early years. But New York City, for a single test, is over 80%. And part of that difference, I think, again, is what Oceana is saying, is that we have a transportation system built in New York City and many, many medical clinics, freestanding and other locations where you can get the blood tests done. That helps. Having a machine that can do a finger stick test in the clinician's office also helps, so they don't have to go wandering somewhere else. Even just going from one floor to the other, from the doctor's office to where the blood drawing facility is in the same building, there's a drop-off in testing. So there are many factors that result in not having a greater than 90% success rate in really assessing whether kids have elevated leads. And the reason for having to do blood tests is that kids don't have symptoms that are clearly related to lead at these lower levels. Stomach aches, constipation that occurs in kids with leads of 20 or more. They're very common in little kids, but it's not a specific finding. The hyperactivity, the loss of cognitive scores, if you lose 4 IQ points, you're not going to know, and the parent's not going to know unless you happen to be tested before you got lead poisoning. The higher your lead, the more IQ you lose, the more it becomes evident that the kid isn't learning as well as they used to. So we see changes over time. So all of that is the driver for having to do blood lead test screening to find the kids who are exposed, eating, absorbing, and distributing the lead in their bodies before they become symptomatic. And it's evident to everybody, from the parents to the teachers.
Thanks so much, Maury. And we're going to take one more question and then close out the webinar. I will say that everything that has just been said emphasizes the idea of primary prevention, dealing with the housing stock and other sources of lead so that kids are never exposed. John, do you want to tee up the final question?
Yeah, I think the final question, and we can go back to the slide deck, is just, what are some things that we can do about this issue? So we'll do our last slide, and we realize we're over, and we'll let folks go.
With the slide, you'll basically see, as Rebecca talked about, we really need to focus on how to leverage various types of funding and technical experience and capacity building support to address this issue. And we need to have flexibility to do that. We need to have programs that enable the kinds of multi-stakeholder partnerships at the local level that are proven to be most effective. Right now there is a $10 million financing pilot in the House THUD appropriations bill that helps to essentially do exactly that. Look at innovative ways of leveraging different sources of financing and technical support to address these issues. So with that, I thank you very much for those that stayed with us over a little bit, and to all of our panelists for joining us this afternoon. I hope that you will all, if you have any questions, the members of Congress that are on the call, please go ahead and reach out to us and encourage your boss to support innovative efforts like the National Lead Financing, Lead Safe Home Financing Fund. Thank you so much for joining us today.